Hi, this is Jerry Hesch with the Hesch Institute in Henderson, Nevada, and this is a very rare finding. We have been treating this client, and one of the last patterns that she presents with is a rare side bent ilium fixation on the right, and that is not described in the SIJ literature. That's a discovery I made several years back, and this case is titled Sacroiliac Instability ? Sacral spring test injury in a medical student. And she sustained an injury when she was receiving a treatment during a lab in med school, learning how to treat sacral torsions. And the Hesch Institute is in Henderson, Nevada, very close to Las Vegas. Our website is www.heschinstitute.com, spelled H-E-S like Sam, C-H. Thank you. And so a side bent ilium pattern is similar to a anterior ilium or a posterior ilium pattern, except that the spring tests that I use for an anterior or posterior ilium are negative. Okay? On the right side, I can create anterior rotational mobility, and you can see it recoil. Okay? I can create superior mobility through the pelvis, and you can even see her head bob up and down, or her shoulders bob up and down. So movement is transferring through the pelvic structure. I don't make the claim that it isolates movement only in the SI joint. That's not possible. Okay? And an inferior spring, or even you might call it a posterior rotation spring test, you can see the movement translates through the lower body. Where the movement does not happen is when I come and I'm capturing medial, inferior, and just a little superior to the PSIS. I'm on the ilium, and I'm springing it that way, and I can't even take up the slack. And I'm putting a reasonable amount of force, and there's no movement. And then I'm drawing it towards me, and I cannot induce movement. On the other side, same test, you can see I can take up the slack very readily, and I can induce some spring mobility with recoil, and I can do it in the opposite direction. Okay? Would you lie on your back, please? Now, we have been treating several patterns in her. This is part of a bigger case study, but this film here focuses only on this element of the side bending. And one of the things that cued me to look deeper and search for that pattern was the fact that even though we have relative symmetry, you know, pelvis looks quite symmetrical compared to how it looked previously today. I was not happy with the spring mobility. Now on the left, you'll note I can take up the slack and I can create some spring mobility, and you can see it recoil. On the right side, yes, I can take up the slack. Yes, I can spring it, but there's no recoil. It is so dampened, it is so delayed. When I spring and let go, it's just so slow to come back. So it feels hypermobile on this right side. It's just very, the movement is just very aberrant. Not in the forward spring. You could, you might say, well, that's normal. You can take up the slack and you can spring it forward. But the lack of recoil really speaks to me. So I'm going to go ahead and treat it. And the treatment is very straightforward. I isolate forces in that joint to side bend the ilium medially, and so I use hip abduction, okay, and I palpate to make sure I isolate that area, use a very gentle overpressure, and I maintain it for 2 minutes. So it's very logical. I mean, it almost is, like this, abducting the hip and isolating the force there. So we're not going to film the treatment, but I'll film the after effect very soon. Thank you.